Welcome to the Vibrantly You podcast. We're your hosts, Megan Martineau.
Caitlin Cipriano. In this podcast, we talk about fitness and nutrition on your motherhood journey. Whether you're trying to conceive, pregnant, postpartum, or beyond, you're welcome here.
Nothing is off limits, and our goal is to support you in this important season of life so that you can feel vibrantly you. As a reminder, this information is not medical advice. Please see the show notes for more details. Welcome back to the Vibrantly You podcast. Today, I'm doing a solo episode on low back pain in pregnancy. So before we dive in, I do want to remind you that I am hosting a free Strong in Pregnancy class next week on Wednesday, April 2nd. So I will make sure to drop the sign-up link for that in the show notes if you're interested. This is going to be a great class. We're going to have a lot of information on exercising safely in pregnancy, followed by a workout that is safe for all trimesters. So definitely make sure you come and join. Okay, so now on to talking about low back pain in pregnancy. So this is something that is so common and can also be pretty miserable to suffer with for 9 months. But the good news is, like many other pregnancy aches and pains that we have talked about here on the show, is that you don't have to just suck it up and suffer with low back pain. There are things that you can do in terms of body positioning, daily activities, as well as strengthening exercises to support your alignment and body to reduce this low back discomfort. So let's talk about what exactly is low back pain, because I do feel like sometimes low back pain and pelvic pain tend to get confused. So low back pain is not SI joint pain. So SI joint pain is occurring in the back of the pelvis. Like I said, it can be confused with low back pain, but if you suspect that you're experiencing SI joint pain, check out episode 15, where we do a deep dive into that. But low back pain is going to feel like pain or tightness in the lower lumbar spine, and close to 70% of people actually experience low back pain due to alignment shifts, changes in center of gravity, and weak core muscles. So this is a very common pregnancy ailment and an annoying one. So let's talk about like what you can do in terms of body positioning and daily activities to help reduce this. So standing with a stacked position, which means having your rib cage stacked over the pelvis. Now, you don't always have to be in like this rigid, straight position, but just thinking about bringing that rib cage over the pelvis and not having the ribs flare or stick out, because then that's going to cause that curvature in the low back. Another thing to be mindful of is keeping your pelvis in neutral alignment. So same thing, we're trying to avoid like exaggerated or prolonged periods of an anterior pelvic tilt, which is when your like tailbone is sticking out, when your butt is sticking out, because this compresses the lower lumbar spine. So we just want to try to keep that pelvis in a nice and neutral position. Another thing that you can do is pay attention to overhead upper body movements, because this typically creates that rib flare, like I mentioned, and the low back arching. So not just with workouts, but think about any time that you are bringing your arms up overhead. If you're lifting something up overhead, so this could even be like, you're putting dishes away, you're emptying the dishwasher, right? And you have like a mug and you're like reaching up to put it on a high shelf. Think about keeping your ribs stacked over the pelvis and not having that exaggerated arch. Movement is going to be your best friend with low back pain. So trying to stay in motion in pregnancy in general is just going to help you feel better, but especially with that low back pain. And then you can also do some targeted stretches. So things like a cat-cow. So you're getting nice flexion and extension in that lower back. And then a half kneeling hip flexor stretch can be really helpful as well in stretching that low back. Now, while body positioning throughout the day and stretching can offer some relief in the moment, the stretching offers relief in the moment, but I will say like the body positioning and daily activities, if you're consistent with them, do make a big difference. But strengthening exercises is really where the magic happens. So there are a couple of things that I want you to think about in terms of strengthening exercises. So you're going to make sure you're doing your 360 breathing, as often as you can. I know I literally talk about this in every episode, but this is where you're going to get a nice deep inhale breath, feeling the expansion of the rib cage, your pelvic floor relaxing and lengthening. And then on that exhale breath, your rib cage contracts, you're blowing out all that air, and that pelvic floor passively lifts. You're going to want to develop a strong core canister. So this is basically like training those deep core muscles. So this is going to be activating the transverse abdominis and your pelvic floor, again on that exhale breath, to counteract the pull on the low back. If we have strong abs and a strong core, it's going to put less pressure on that low back, especially as the belly continues to grow. Strengthening the glutes is going to be really important, and this helps in a really big way. During pregnancy, the glutes can just get really lazy. They just shut off, they don't do their job, and this is not great because, the glutes are the biggest muscle in your body. We need them to be doing their job, and when they aren't, the smaller accessory muscles take over, like the low back. So we want to really be prioritizing strengthening those glutes. You can also implement assisted exercises like rows. So rather than standing and performing a row, you can do an assisted bent over row. So this is where you would have your knee on a bench, kind of like a 3-point row. So it would be resting your knee and arm on the bench as you're performing that row, because that'll also help reduce pressure on the lower lumbar spine. So just trying to think about some ways that you can modify some exercises to reduce that pressure on the low back. So really, when it comes to strengthening, we're really wanting to think about glutes, abs, everything that's going to help reduce the pressure on that low back. So really, in summary, this is a short little episode, but I do think it's an impactful one because, like I said, a lot of people do struggle with low back pain and it can be really annoying. But these tips can be really helpful. So things to remember are paying attention to your alignment, building a strong core, building strong glutes, and then also doing some targeted stretches to offer some short-term relief. So that wraps up today's quick solo episode with me. And remember, if you are currently pregnant, head over to the show notes and sign up for my free Strong in Pregnancy class that's happening next Wednesday on April 2nd. I really hope that I see you there. It's going to be so much fun. Thanks for tuning in, and I will talk to you next week.